Hello and welcome, everyone. I'm absolutely delighted to introduce you today to Professor Caroline Fitzpatrick, PhD. She's a lead director and researcher of the Digital Lab at Sherbrooke University in Quebec. Caroline's going to talk us through the depth and breadth of her research, but it is a vast amount. So we're going to stick to the main topics of looking at the early childhood exposure of screens, exposure of children to screens in early childhood years, and the concept of digital dummies, and then the impacts of excessive internet use on adolescents, illustrated by Caroline's research. And we'll touch on parental smartphone impacts as well. Welcome, Caroline. We're so looking forward to your talk.
Thank you so much, Rebecca. It's a real pleasure to be with you today. So good afternoon to everyone in the UK. Thank you so much, Rebecca and Arabella, for this invitation. My name is Caroline Fitzpatrick. I'm a professor of child development at Université de Sherbrooke, and I am also the Canada Research Chair on digital media use by children. So I'd like to acknowledge today that my two PhD students, Marie-André Binet and Emma Christini, did help me put together the slides. So if you think some of these slides are nice, it's probably thanks to them. So it's important for me to start by announcing that I do not have any conflicts of interest. None of my research is funded by industry. And this is important because some researchers in my area are funded by industry, and this conflict of interest is not always disclosed. So I would encourage you when, assisting and when you're consuming information to make sure that, or to inquire about potential conflicts of interest. So to provide a little bit of context, I'd like to say that, or to remind you all that the digital environments of young children and their families have changed dramatically over the span of a few decades. And I think one of the most important changes has been the increased popularity of mobile device use by young children. So children are using mobile devices more and more, and they're using them at younger and younger ages. So, of course, mobile devices share characteristics with traditional televisions. We can watch our favorite show on either device, but there are some characteristics of mobile devices that I would like to highlight. And that's, first of all, that they can connect to the internet. So this means that contents become available on them in unlimited quantities and on demand. Second, mobile devices and many of the apps on them use personalized algorithms. So this means that they can, suggest contents to users, and this makes them even more engaging. And finally, I would like to say also that because of their small size, we tend to bring mobile devices with us. To restaurants or during travel. So this can be very practical, but it can also increase how they might interfere with ongoing interactions or activities. And similarly, because of their small size, mobile devices are conceived for individual and personal use rather than family use. So another trend that I would like to highlight is that digital media use seems to be more prevalent or more common amongst families that are lower socioeconomic status. And screen use among young children seems to be increasing more rapidly for those in lower income families. So the digital environment of young children also includes their parents' screen use. So according to one study, parents of young children report using screens on average 5 hours per day for leisure outside of work time. And interestingly, the majority of parents say that they would like to use screens less. And a high proportion of parents also self-report that they believe they use their screens too much in the presence of their child. So children are also exposed to screens in their daycare and school settings. So this is data from the province of Quebec, stating that 75% of children are exposed to screens in their kindergarten classroom. And some of this is educational screen time, but some of this is also leisure screen time. So playing movies as rewards or playing videos during lunchtime and snack time are not uncommon in school settings. Now, these are some statistics from the UK, so thank you very much, Rebecca and Bella, for sharing these with me. So I thought it was very interesting that when surveyed, 54% of kindergarten teachers believe that too much screen time reduces school readiness. And in addition, a similar amount of teachers also report that too much parent screen time can interfere with child school readiness. So there are current recommendations, and specifically in Canada, the recommendations around children's screen time is that children not be exposed to screens before the age of 2, that screen time be limited to 1 hour per day between the ages of 2 and 5, and then that children try to respect a limit of 2 or maybe 3 hours of leisure screen time above the ages of 5. So, as I mentioned, this is for leisure screen time. So, for example, time spent on a computer doing homework could be excluded from these recommendations. So, one of the reasons these recommendations exist is because, and one of the reasons why they're more strict in early childhood is because the habits and preferences that we develop early on are likely to be maintained at other life stages. And the behavioral habits we develop might even intensify over time. So I think this is why early childhood is a really critical period, because if we can help children develop healthy, balanced screen use habits, we might be able to inoculate them against more costly behaviors down the road. So in my work, I like to conceptualize screen use and its consequences within an ecosystemic framework. So in this sense, I understand that screen use is going to be influenced in part by children's individual characteristics like their sex, their temperament, their age, the interactions they have with different settings in their family setting or in their daycare setting, and also by some more distal characteristics, like, for example, priorities set forth by the Minister of Education, resources that exist in a neighborhood or a community, and things like parents' working conditions. If a job requires that parents be accessible or reachable all the time by cell phone, this could also have an influence on children and families. And finally, I think that macro-systemic factors like laws that exist in a society to regulate the tech industry also play a role. So I also like to conceptualize screen use as a multidimensional phenomenon. So we talk about screen time a lot. This is the dimension that's been studied the most, and it represents the amount of time that children accumulate in front of screens. So of course, this is an important dimension. It's the dosage of screen use, but I think it's not the only dimension that we want to think about. So content is also important. We do know from decades of research that some high quality programs that were actually designed in consultation with developmental psychologists like Sesame Street can actually help children learn some school readiness skills. In contrast, racial and gender stereotypes and scenes of violence are also common in media that children consume, and these could have a more negative impact on children's self-esteem and psychosocial development. In addition to this, the nature of use, or how children are interacting with screens, is also important to consider. So there are studies that have provided some evidence that using Skype or other video chat technologies can help children develop some communication and social skills. This type of screen use can also help, increase, solidify family bonds. So this is likely to be a much more positive use of screens than, for example, watching videos stream passively on YouTube. Finally, the context of use is also important to consider. So this can refer to how adults are using screens in the immediate environment of children. It can also refer to the quality of accompaniment that children are receiving during screen use. And context can also refer to the specific timing and location of use. So we know that use during meal times or use late at night can generate additional health risks for children. And finally, I would again say here that it's important to consider all these dimensions while thinking about children's individual characteristics, like their age, their sex, their gender, and their individual profiles of strengths and weaknesses and cognitive, social, and physical areas of development. So there are why would screens influence child development? And I'm going to propose here 4 possible explanations for different mechanisms. So first of all, regardless of what children are doing in screens, there's increasing concern that some of the physiological characteristics of screens, either blue light or the fact that they're small and we tend to hold them closer to our face and our eyes, these could contribute to problems with the development of visual systems and could also lead to sleep problems in young children. In addition to these mechanisms, another theory that's often cited or hypothesis that's often cited is the displacement hypothesis. And according to this explanation, when children spend a lot of time with screens, they simply have less time for real life face-to-face interactions, playing make-believe, spending time outside, and sleeping. We also know from decades of rigorous research that children learn a lot through social learning processes. So typically, children will observe and imitate their parents, their friends, their brother, their sister, but children can also learn to imitate their favorite character from a video game or a television show. And finally, we know increasingly that certain types of screen use might be especially disruptive for children's developing attention and reward systems. And this might be the case for screen activities that incorporate virtual reward mechanisms like loot boxes, or incorporate red hearts or rewards for streaks. So some of these mechanisms can help us understand why screen use might have an impact on academic outcomes and mental health outcomes. So in 2019, when I was a professor in Nova Scotia, Canada, I received a grant to study how more traditional and also newer screens might be influencing children's global development. So this was actually my first big grant, and I was very, very excited to undertake data collection in the winter of 2020. But as you might remember, this is when the pandemic happened. So with some sort of last minute changes to our data collection protocol by making everything online, resubmitting to ethics, we were given the green light to pursue our research on screen use during the pandemic. So we were able to collect data from about 300 families in 2020 during lockdown. We were then able to follow up with families 1 year later when children were 4.5, and then we conducted a second follow-up at age 5.5. And in 2022, when we did our third assessment, the public health regulations had softened a little bit, and we were able to conduct some home visits, so to get some direct measures from the children. So this was a study that was conducted in Nova Scotia, Canada. Nova Scotia is a very small province in terms of land and in terms of population in the most eastern area of the country. So what did we find? Well, first of all, we looked at how much screen time children were getting during the pandemic, and perhaps not surprisingly, the majority of 3.5-year-olds were exceeding the recommendation of 1 hour or less per day. In fact, they were double exceeding the recommendation. So most children were spending more than 2 hours per day using screens. And perhaps more surprising, we found that the use of screens during bedtime routines was very common. So 56% of parents reported that their child used screens within the hour before bedtime every night or almost every night. And we also found some risk factors that were associated with these screen time habits. So children with more difficult temperaments were exposed to more screen time, and lower income families also exposed children to more screen time. So here I'm going to present the research, Marie-André's master's research. So Marie-André, first of all, wanted to see how many children were following the recommendation during the pandemic at the age of 3.5. So she found that there were about 15% of children following the recommendation. And then she identified two other groups, a more average user who spent between 1 and 4 hours per day using screens, and a intensive screen use group, which spent more than 4 hours per day using screens. She then wanted to see what the consequences might be 1 year later on global development. So she measured global development using the Ages and Stages questionnaire. And this questionnaire allows us to distinguish children who are showing risk in terms of their global development and those that are not showing any risk in terms of their global development. And here's what she found. So for the children who followed the recommendation, there were about 7% showing risk in terms of their global development. This number of children at risk increased to 13% for those who were a bit more moderate in their use. And finally, for the intensive use group, this number increased to 25%. So essentially data that falls in line with a dose response association. So we also looked at tablets separately, and we found a similar pattern of results when we just look at tablets. So you might be wondering, well, what were children doing on the screens? So here are some parent reports of activities that children did on screens. And as we can see, just over 50% of parents reported that their child streamed shows on Netflix or Disney Plus at least once a day. And almost 30% of parents also reported that their child viewed videos on YouTube at least once a day. So these were by far the most popular activities. Reading ebooks, playing with apps were a lot less popular. So as an early childhood researcher and somebody who has been interested in school readiness for a long time, I wanted to see if children's screen use might be associated with their development of executive functions. So just as a very, very quick and brief reminder, executive functions are cognitive processes that allow us to have a certain amount of willful, effortful control over our thinking, our behavior, and our emotions. And they include cognitive flexibility, which allows us to switch between tasks and adjust to unforeseen circumstances. Working memory, which allows us to update and manipulate information in real time. And inhibition, which is essentially our mental braking system. It allows us to stop an automatic behavior long enough to think about the consequences. So together executive functions are essential for school readiness, and they also contribute to the ability to get along well with other children, and even seem to contribute to the adoption of healthy lifestyle habits. So during our third year of the study, we were able to directly measure child executive functions during a home visit, and we also had 3 years of screen use data. So to maximize on all these data points, we decided to estimate some trajectories of screen time and look at how they contributed to child executive functions. So these are the trajectories that we estimated across the ages of 3 and 5. So I'll just draw your attention to the top line, the red line here. So we found that approximately 20% of children in our sample followed a high screen use trajectory, which means that they spent on average 6 hours per day using screens between the ages of 3 and 5. We also had a more moderate group of children who spent on average 3 hours per day using screens between the ages of 3 and 5. And finally here, I think this is maybe the most interesting trajectory, is the low screen use group. And they spent essentially just under 1 hour per day using screens. So this is a group that followed the recommendations. We measured executive functions using standardized and validated assessments of inhibitory control and cognitive flexibility for children aged 3 to 7. And here are the results. So I'm just going to draw your attention to the blue bars here. So the blue bars are the proportion, represent the children who respected the recommendation, so the low screen users. And as we can see, the low screen users are consistently scoring the highest on both measures of executive functions. And in contrast, if we look at the gray bars representing the children in the high screen use trajectory, they are consistently scoring the lowest on both measures of executive functions. So in addition to these studies, we've also recently looked a little bit more at screen use and child health outcomes, and we have found that more screen time at the ages of 3 and 4 was associated with a greater risk of the child becoming overweight by age 5.5, and more screen time was also associated with less light, not intensive physical activity. And if you want to know why this association is present for light physical activity, but not more intense physical activity, we can possibly talk about that at the end of the talk. So important for me to also mention that correlation does not indicate a cause and effect association. And this is obviously the case in screen use research. So one problem that often comes up is the issue of the chicken and the egg. So what's coming first, developmental difficulties or the screen use? So it's important to untangle this and to address this issue of potential reverse association or of bidirectionality. So there could be associations in both directions. So in order to address this chicken and the egg issue, we conducted a series of studies in which we repeatedly measured children's screen use and their development of self-regulation skills at the ages of 3 and again at the ages of 4. So we measured 2 dimensions of self-regulation, their ability to regulate negative emotions like anger, and their effortful control, their ability to willfully control behavior and successfully direct their attention. And what we found was that children's baseline self-regulation did not contribute to how much time they were spending on screens 1 year later. But screen use, the amount of time children spent using screens, did contribute to more self-regulation difficulties 1 year later. So as I mentioned, the context of screen use matters, and as I've heard it referred to in the UK, there is a phenomenon called the use of digital dummies, so using screens essentially as a pacifier. This has also been referred to as digital emotion regulation. So it represents when, for example, a parent or another adult might use a screen or hand a screen to a child in order to avoid a tantrum or to calm them or to soothe them. And we've been interested in examining whether the use of this strategy over time might actually backfire and contribute to poor self-regulation in children. So we conducted a study with Hungarian colleagues in which we measured the strategy of using screens to calm a child when the child was 3.5. And then we then measured their self-regulation skills 1 year later, and we did find that more of this strategy, using screens to calm a child, was associated with worse effortful control and more expressions of anger and frustration. We did not find any associations, any significant associations in the other direction. So children who had more difficulty with their self-regulation did not tend to elicit more screen use to calm them 1 year later. Here I'm presenting some the results of my PhD student, Emma Christini, and Emma has been interested in another context of screen use, which is background media exposure. So this is when an adult might be viewing a program and the child just happens to be in the room, or it could be because the television is on or another screen is on and nobody in the family is specifically paying attention to the screen. So it's when the screen is not the child's primary activity. So Emma has looked at 3 different groups of exposure to background media between infancy and early childhood. So these children were followed longitudinally. And she then examined the school readiness of these children. So she found that children who were more frequently exposed to background media arrived at school less well prepared in terms of their vocabulary and number knowledge. And more frequent exposure to background media was also associated with worse scores on nonverbal IQ and measures of attention. So what should parents do? What is the best strategy for managing screen use in early childhood? So I unfortunately don't have any definitive answers, but maybe some suggestions for moving forward. So in one study, we decided to compare 3 parental strategies for managing child screen time to see if the use of different strategies might actually be protective or might actually predict the child following recommendations 1 year later. So what we found was, so we compared 3 strategies. The first one was restrictive mediation, which involves putting in place limits and rules around child screen time. We also measured social co-viewing, which is when parents and children enjoy media together, and instructive practices, which is when parents ask questions, explain things to the child with the ultimate goal of stimulating a sense of critical thinking around screen media. So we compared these 3 strategies in the same model, and what we found was that parental restrictiveness, so the use of rules and limitation, increased the chances of a child respecting the screen time recommendation 1 year later by 4. So this was the most effective strategy for limiting screen time. So what exactly is restrictive monitoring? I'm sharing here the items on the measure because I think they're very concrete. And essentially they involve setting rules and limits, not just around child screen time, but also around which context we want to favor and which contents we want to forbid and those that we want to encourage. So I am going to talk a bit more briefly now about adolescents' screen use. I think it's important to talk about adolescents separately because their use is slightly different from that of younger children. So first of all, they're less supervised when they use screens. They also spend more time on social media and they spend more time playing video games. The characteristics of adolescence are also important to consider. So adolescents experience increased emotional reactivity and impulsivity and sensation seeking, and they also become a lot more sensitive to peer influence. Finally, I'd like to highlight a few differences between boys and girls. So although boys and girls spend similar amounts of time using screens, what they do on screens is slightly different. So girls spend more time using social media and chatting, and boys spend more time gaming and accessing sexually explicit or pornographic contents online. So as you can see by this chart, adolescents spend a lot of their leisure time using screens. So during the pandemic, this skyrocketed to about 8 hours per day. And we can also see that screen use by adolescents tends to vary according to some socio-demographic characteristics, with more disadvantaged adolescents tending to spend more time using screens. So I'm sharing here some data that generated a lot of interest when it was published. I think what I'd like to draw your attention to is the very sharp increase in female symptoms of depression that occurs. And this sharp increase that we see on the graph is occurring around 2012. So I'll ask this rhetorically, but you might wonder, well, what happened in 2012? And one of the things that did happen, well, there was, the popularity of the iPhone was exploding at that moment, but it was also the launching of Instagram. So this has led a lot of researchers and the public to point the finger at social media as the reason for these increased rates of depression, especially amongst adolescent girls. So again, we cannot draw any causal um, inferences from historical and correlational data. However, I found this recent statistic, extremely interesting and indicative. So when polled adolescents and young adults, the majority do report that they believe that their own screen use is problematic. And in addition to this, there have been some studies, mostly correlational and cross-sectional, showing that an individual's screen media use can be associated with greater depression and anxiety, more impulsivity, and decreased pro-social behavior. Amongst girls, there's also increased risks of developing a poor body image. So again, these correlational studies are not sufficient to really address the chicken and egg issue. So a similar chicken and egg issue appears here, where we might ask ourselves, well, it could be social media that's leading to poor mental health, but perhaps youth with poor mental health turn towards social media as a way of avoidance, as a way of handling their stress, as a way of feeling some rewards or getting some pleasurable feelings. So this is often an argument that's brought up. Maybe the association is in the other direction. So we conducted a series of studies, again, to try and address this chicken and egg issue. This study is based on a Quebec longitudinal study in which internet use and symptoms of major depression were measured amongst adolescents between the ages of 13 and 17. So in this study, what we did is we tried to take things a step further. In our analyses, we compared each participant specifically to themselves. So we just looked at within-person association, so that Thelma is compared to Thelma over time, and Louise is compared to Louise over time. So each person is compared to their own baseline. And what we found in this study was that more hours spent online was associated consistently with increased within-person level change in depression symptoms. So more internet use was associated consistently with more symptoms of major depression across the ages of 13 and 17. We did not find any statistical evidence that adolescents who were more depressed tended to spend more time online. We used a similar analytic strategy to look at how screen use is associated with pro-social behavior. So pro-social behavior is your tendency to act with altruism towards other people and show empathy towards them. And we found that higher levels of screen use by both adolescent boys and girls were associated with less pro-social behavior 2 years later. And finally, this is work from my postdoctoral intern, Gabriel. He looked at internet use and the development of symptoms of anxiety, and he found that girls who spent more time online developed more symptoms of generalized and social anxiety. But he did not find that over time, girls experiencing more anxiety tended to turn towards increased internet use. So it's important to mention that there are benefits of screen use and in particular social media use that have been observed. So research has indicated that social media use can help reduce feelings of solitude in youth and increase feelings of social support and self-confidence. Um, Adolescents also report that social media can help them with identity exploration and can be useful for building and maintaining friendships. Again, as a caveat here, I think it's important to also state that a lot of the research showing benefits of social media use have been based on smaller qualitative studies. And very few of them have actually looked at modern social media platforms like Instagram or TikTok. So I will end with some suggestions. So first of all, I think that it is important that we keep sensitizing families and youth themselves to the potential consequences of screen use and social media use. I also think that it's important to support families and to support youth into adopting healthier, more balanced media use habits. And one way that I think we can help families with this is to encourage them to adopt a family media use plan. So a plan can provide some rules and regulations for screen use activities for the different members of the family. I also think that if we want children and families to spend less time on screens, it's important that we ensure that families have access to affordable screen-free leisure activities in their neighborhoods and in their communities. And finally, parents can also be cautioned to show a good example of balanced screen use activities. In terms of daycares and schools, I think that it's important that we start more systematically training teachers about the consequences of unbalanced or heavy screen use on child development. I think it's also important that we encourage educators and teachers to avoid and limit screen use for leisure in the school setting. Similarly, I think it's important that we encourage them to limit reading on screens. And in the same sense, I think that school environments become an essential place to encourage children to be active and also to introduce them to a variety of activities or leisure activities that are non-screen based. So, for example, outdoors, cooking, gardening, music, and physical activity. So here I'm sharing some of the infographics that my team has generated. So for most of the studies that we publish, we also create a short infographic to summarize our main findings in a way that's more easily digestible for parents or non-academics. So we've now developed these in several languages, including English, French, Spanish, and Portuguese. And that brings me to the end of this talk. So thank you so much for listening to me today. I'd also like to thank my team and the students that contributed to these projects, my wonderful colleagues, and also all the families that have participated in our research.
Caroline, that was fantastic. Thank you very much. I have a list of questions that people have put to us before this afternoon, and if any pop up on the chat, we'll try and get those in as well. If we just focus on, so the question is, are the effects of screens reversible or permanent? Well, can I just put that in the context of, say, the preschoolers with the excessive screen use and the impacts on global development? What would be your kind of approach with that? And does it shape different sorts of intervention? You know, how we'd kind of say, you know, these dreadful references to detox or withdrawal. What's your views on that?
That's a fantastic question, and I think there's probably several different answers. So again, I think speaking to your point, Rebecca, if the screen use has been intensive for a long period of time, I believe that the intervention required to reverse the effects is probably going to be a lot greater than if measures are taken sooner. So there has been some research out of a group in the United States in which they've been looking at very young children's screen use, and what they've been finding is that reducing screen time in very young children can create reversible consequences. So after reducing screen time or eliminating screen time from these young children's routines, she found positive effects 3 weeks later. So 3 weeks later, started to see behavior bounce back, regulatory skills recover. But as we know, plasticity can depend on developmental stages and can also show individual differences across different children. So I would say based on the chronicity, how long, how extensive the screen exposure has been, this will influence how long the recovery from excessive screen time will take.
And that's reassuring, isn't it, for parents if we're educating them correctly, that the sooner you get in, the better, and you might see improvements relatively quickly.
Absolutely. And there are probably differences based on whether we're looking at sort of physical consequences or psychosocial consequences, behavioral consequences. So, some of the physical consequences, like becoming overweight, might be a little bit hard to reverse than some irritation that the child's starting to experience when screens are removed.
Brilliant. And your infographics, Caroline, we share regularly in your various translated forms. They're incredibly useful. So with the one on sleep, we've got a question on sleep here. So what evidence can you share from a digital perspective that highlights the risk screen time poses on sleep? I know it's quite a commonly reported and researched area, but from your research, what are your kind of bullet point headers?
Yeah, so we haven't measured any of the physiological mechanisms directly. So all we can do is sort of base ourselves on what our hypothesized mechanisms are, and that is that the emitted blue light might be disruptive to circadian rhythms and sleep rhythms. So that could be why we see these negative associations between screen time and sleep duration and sleep quality in young children. And I also think that depending on what the child is doing on the screen, if they're watching a fast-paced show for children, this just might be too stimulating for them as they're getting ready for sleep.
Yeah, and those certain more vulnerable groups are particularly susceptible, aren't they, to the harms from these short reel content as well. So to move on in that theme, one of our questions here says, should we change the way we are diagnosing ADHD and autism in youngsters based on the increase in digital screen use?
That's a really intelligent question, and as I am not a clinician, I don't think this is my area to comment on, but I do think that it's going to become essential to ask about children's screen media habits in these contexts, because that has been an observation of the same research team I was talking to about in the United States, where they were seeing these cases of virtual autism. What they would call virtual autism is that the child has spent so much time on screens that they're showing some delays in their social and communication development. But this does seem to be reversible once screens are removed from children's children's routines. So I think that it is important to at least ask some questions about the screen use habits in these diagnoses of these disorders.
Yeah, that's interesting because I can see one of our neurodevelopmental psychiatrists is here with us. He certainly reports seeing reversibility in ADHD symptoms. He's clapping now when you take the screens away. Can I ask a question, Caroline? We have a real worry as health professionals in our daily practice at what you illustrated about lower income families actually being more vulnerable and being on these screens more, so they're more vulnerable and susceptible to the harms that come with that. And I just wondered, we have a bit of an issue over here that even charities that are, deemed responsible for looking after children are saying that these vulnerable children need these devices more or need these platforms more. And we would dispute that because most of the reports say completely the opposite. What's the kind
Yeah.
of feel around that where you're working?
Um, well, that's an interesting question, and I think some of it belongs to resource. And I think these are statistics that came out initially saying that there's a digital divide in schools, for example. So children in these more well-resourced schools have access to technology, so they're acquiring these valuable skills in how to use technology, and we need to change that. And it did happen. I think now there's been sort of a reversal where lower income schools were getting technology essentially for free to use in their schools. But technology in and of itself is not going to promote learning outcomes unless it's used judiciously. So I think that needs to be kept in mind. Like, yes, there's a digital divide, and low-income children have less access to computers in their home, but they have more access to phones and tablets. So there's also a quality issue that needs to be resolved. And I think throughout this, there's also the idea, and I can completely understand and relate to it. The idea is that technology, early exposure to technology will make this child more media savvy, more tech savvy, might put them online to a STEM career. So there's kind of this reasoning that we have that exposing children to technology has to be enriching cognitively, which it is not. If we're just using it, we're not creating the tech. So it's not necessarily an added value to children's lives to be using tech early on.
Well, hallelujah to that. I mean, as the UK are probably some of the biggest consumers of ed tech that you reference in the world, and I think there's a lot of evidence coming out now that the more that's used in an educational setting, the worse the children are doing attainment-wise. So just referring to your Canadian guidance, and I think you referenced WHO as well, with your 0 to 2 no screen time, 2 to 5 1 hour a day, 5 plus 2 hours a day. We definitely reflect that in the guidance, and we've obviously discussed this, haven't we, Caroline, and shared this. But interesting, the Spanish Pediatrics Association has come out quite robustly with a similar thing, but saying that this absolutely should include time that screens are used in the school day as well. Because I think what's been highlighted here, particularly eruditely by a lady called Sophie Winkleman, I must send you that talk actually, Caroline, because it's sensational, is that parents are trying really hard to moderate their child's screen use at home, and then they're on their devices all day at school. So what are your personal views on that? Do you feel comfortable sharing your views on that?
Yeah, well, this has been one of my objectives, and I think a real blind spot in the research is that we have few studies that have looked at the accumulation of home-based and school-based screen time. And even it's been assumed for a long time that children are not getting any screen time in the daycare, but they are. We now know that they are. Some are getting 5 hours a week, and some are getting 1 hour. So there's some variation there. But as I said, few studies have been able to look at both the home-based screen time of the child and the school-based and add them up to see, well, is there additional risks? Is there, are risks amplified if they're getting it in two different environments, and if they're getting a lot in two different environments? So I'd say there's a big question mark on that question. But my hypothesis would be that, yeah, I think we need to consider both the school-based and the home-based to really look at the full developmental impacts of screen use in children's development.
Well, we're certainly seeing quite dreadful impacts actually on school readiness on the little ones. There's been a big report from Kindred Squared that came out recently, which has particularly shocked speech and language therapists because their lack of verbal interactions, inability to use books, that sort of thing. Is school readiness a problem in Canada, and are they relating that to screen use? Are they drawing on your excellent research, Caroline?
So yeah, there are similar concerns. So some of the organizations that sort of monitor school readiness every few years and administer standardized assessments have started to look at children's screen use, and it does seem to be in the same vein as being from a low-income family is a risk factor. Having a lot of screen time is also seems to be a significant risk factor in not arriving sufficiently well prepared in kindergarten.
And the final $1 million question, we are trying desperately in the UK to get our public health service, the NHS, to fund a public health campaign to actually communicate with parents. For example, if every household in this country had your infographics on their kitchen table, or we've got some fairly good guidance as well that I know you said is looking good. But what's the health service equivalent in Canada? And are they putting out any guidance at all visibly for free? Are they putting it in places that would be visible to ladies when they're when they're newly pregnant, that sort of thing, early years settings? Is there anything there? Because we are failing over here.
So we have a few initiatives. So some of them are research based. So we have in Quebec, we have the National Institute of Public Health. They've just declared that screen use is going to become one of their priority areas. So they're taking it seriously, but I think they're still at the step of conducting some studies. We also have some programs now that I find very exciting where nurses that are doing home visits for more vulnerable families are systematically addressing screen time with the families that they're visiting. So I don't know that this has become a universal practice yet, but it is starting, and I've gotten feedback from nurses that are delivering this kind of information to parents. And I find that a really wonderful initiative. And I'm also working with another government organization in which we want to develop a universal preventive intervention. So the idea is going to be, can we develop an intervention that's based on sensitization and some accompaniment of families and creating a family media use plan that will reduce screen time in the child and the parent within over the span of a few months.
Amazing. And those more kind of outreach settings, like the community nurses, like the health visitor equivalent, I guess we call it here, are they measuring impact of that, Caroline? Will there be?
Unfortunately not. It's not being measured, but it would be so great if we could measure impact of that.
Well, I mean, you're doing it. That's probably more than we're doing. Although, you know, we're working hard to change things.
You're doing wonderful work, yeah.
Thank you ever so much. Your work's so brilliant, and we shout it out to wherever we go, and your infographics are wonderful too. So keep us posted on all future research, and we'd love to have you come talk to us again.
Absolutely. It was my absolute pleasure. I wish you all a pleasant Monday evening.
Thank you, Caroline. You too.